Hello everybody, welcome back to another Anatomy and Physiology live stream. Today we're going to go over the urinary system and the reproductive system. Hello everybody, welcome in. Thanks for joining. I would appreciate it if you guys gave the live a like. It'll send it out to more people. But hello everybody, welcome in. I hope you guys had a great Thursday. I hope you all are doing well. How's everyone doing today? It's good to see everybody back here in the live stream. Hello, thank you for liking the live. I appreciate you guys. We'll go ahead and get started here in just a moment. We're doing some more anatomy and physiology today. And we're going to do the urinary system first, and then we're going to do the reproductive system. We have about 30 questions for the urinary system, and then another 30 questions for the reproductive system. I think about 10 are for the male reproductive system, and then 20 of those 30 are for the female reproductive system. Thanks for all the likes, guys. I really appreciate it. How's everyone doing today? We'll get started here in just a moment. Hello, hello, hello. How's everyone doing? Thanks for joining. Thanks for liking the live. Alrighty, we'll go ahead and get started now. Hello, everybody. If you are new here, welcome. My name is Ollie. I have a master's degree in molecular medicine, and I do go live every single day covering anatomy and physiology topics and topics that you guys request as well. Today, we're focused on the urinary system and the reproductive system, so we'll go ahead and get started here with question number 1. Which structure of the nephron establishes the medullary osmotic gradient? The medullary osmotic gradient. Thanks for all the follows. I really appreciate it, everybody. Thanks for liking the live as well. We are on number 1 now. What structure of the nephron establishes... Take my urinary and digestive test Tuesday. Awesome. Good luck, Taylor. You got this. You definitely cook on that exam. I believe in you. We are on number 1 now. If you're just joining us, welcome. If you're just joining, hello, hello. My name is Ollie. I have a master's degree in molecular medicine, and I do go live every day, and I post these to YouTube afterwards as well. And then I also have my anatomy and physiology notes that I had when I was an undergrad available on my bio, on my TikTok bio, as well as the YouTube channel. It's linked there as well. I'll give you guys a couple more seconds to answer. For those of you who are just joining, we are on number 1. Have I gone over the respiratory system? Not recently yet, but I did have some videos on YouTube already. We've done the respiratory system in the past. So I do have videos on YouTube right now on the respiratory system, yes. Alrighty, the answer to number 1 is B. It is the loop of Henle. So the loop of Henle plays a key role in establishing that osmotic gradient, basically through countercurrent multiplication. The descending limb is permeable to water, but not ions. The ascending limb is impermeable to water, but it actively transports ions like sodium, potassium, and chloride. That's what creates that osmotic gradient in the medulla. Number 2, which portion of the nephron is impermeable to water, but permeable to sodium and chloride? Kind of answered that in the last question by accident explaining it. The blessing. Hi, Ollie. You're so nice for helping. Yeah, thank you. You're so nice for joining. I really appreciate you joining. Yes, this is going on YouTube afterwards. Yes, it should be up later tonight or tomorrow morning. Just kind of depends on the processing time. We're on number 2 now, if you're just joining. Which portion of the nephron is impermeable to water, but permeable to sodium and chloride? And hello to everyone that just joined. Like I said, this will be available on YouTube afterwards. It's linked in my bio, as well as all my notes for anatomy and physiology. I do have a chapter on the urinary system and the reproductive system. The answer here is B. It is the ascending limb of the loop of Henle. As we talked about in the previous question, the ascending limb of the loop of Henle is impermeable to water, but it actively transports ions like sodium, potassium, chloride, that contributes to the osmotic gradient that we talked about in the last question. I remember the descending limb is permeable to water, but not the ions. Number 3, which capillary network surrounds the loop of Henle in the juxtamedullary nephrons? Awesome. Give you guys a couple more seconds to answer that one. Hello, hello to everyone that just joined. Welcome. Thank you guys so much for joining and participating. We're on number 3. Which capillary network surrounds the loop of Henle and the juxtamedullary nephrons? It's the vasa recta. That's that specialized capillaries that does surround the loop of Henle. In the nephrons, they play an important role in maintaining the osmotic gradient of the renal medulla. They exchange water and solutes essentially without disrupting that gradient. Moving on to number 4. What is the primary driving force of glomerular filtration? What is the primary driving force? Give you guys a couple seconds to answer. If you are joining, welcome. My name is Ollie. I do go live every day covering anatomy and physiology and other topics that you guys do request. We are on number 4. What is the primary driving force of glomerular filtration? The answer is B, glomerular hydrostatic pressure. This is basically because this is in which the blood pressure within the glomerular capillaries. This pressure forces fluid and solutes out of the blood and into the Bowman's capsule. Plasma oncotic pressure. This opposes filtration. It more so has the tendency to pull water back into the capillaries. Capsular hydrostatic pressure. That is the pressure in the Bowman's capsule that works against filtration. But it is not, the primary driving force. And tubular secretion, this involves the movement of substances from the blood into the filtrate, so it would not be a driving force for filtration. Number 5, which structure adjusts GFR via the tubuloglomerular feedback? When am I going to do cardio or even respiratory? That's actually going to be on Saturday. Tomorrow's going to be pharmacology, and Saturday will be cardio and respiratory system. So similar to preclinical med questions. Awesome, yes, that's what the goal. What time? It'll probably be around 2, probably more so 3 p.m. EST Saturday. But urinary system and reproductive system have been requested, and then we will do the cardiovascular and respiratory on Saturday. Number 5 now. I have an exam on this tomorrow. Awesome. Good luck, Maddie. You got this. Number 5, which structure adjusts the GFR via the tubuloglomerular feedback? The answer is B. Just the macula. The answer is B. Just the macula densa. That's that specialized region of the DCT that detects the sodium chloride levels. It regulates GFR by signaling to the glomerular cells to adjust renin secretion. This is going to influence constriction or dilation of the afferent arteriole. Number 6, which ion is actively transported out of the thick ascending limb of the loop of Henle? We're on number 6 now. Everyone that's here. Which ion is actively transported out of the thick ascending limb of the loop of Henle? I'll give you guys a couple seconds to answer. The answer here is sodium. C. Answer choice C is the correct answer, sodium. So in our thick ascending limb of the loop of Henle, it's going to actively transport sodium, essentially also along with potassium and chloride. But this one is more so out of the thick portion. Potassium is exchanged, but it's not our main ion actively transported out. Moving on to number 7. The majority of glucose reabsorption occurs in the what? The majority of glucose reabsorption occurs in B, the proximal convoluted tubule. This is where it gets reabsorbed via the sodium-glucose symporters. Number 8, which transport mechanism is used for glucose reabsorption in the nephron? Which transport mechanism is used for glucose reabsorption in the nephron? This is what I'm learning in class right now. Awesome. So glad, Melissa. Thanks for the follows. I really appreciate it. Thank you guys so much. Number 8, which transport mechanism is used for glucose reabsorption in the nephron? The answer is D, secondary active transport, which is our sodium-glucose symport. Glucose is reabsorbed in the proximal convoluted tubule via the secondary active transport mechanism. Essentially, sodium ions are actively transported into cells, and glucose will follow that through the symporter, which we've mentioned here is the sodium-glucose symport. Good revision for preclinical exams. Thank you so much. I appreciate it. Just took an exam on this day and got an 88. Congratulations. Just had a test on this last week. Final in a few weeks. Awesome. Good luck on your final. Number 9. What happens when the transport maximum TM for glucose is exceeded? So secondary active transport with the sodium glucose importer is also referred to as co-transport, if that makes sense. I can definitely put this on my website afterwards if people are interested in downloading it. I do post this to YouTube afterwards as well. But if you guys want a download of this, I can put it on my website, and I will put it on my TikTok story for a link for you guys to download. Yes, please. Awesome. It will also be on YouTube afterwards as well. That's linked in my bio. So is my website. My website is linked in my bio. I have also all my notes for anatomy and physiology there as well. Number 9. What happens when the transport maximum for glucose is exceeded? Awesome review. Thank you so much. I appreciate it. Thank you to everybody that is new here. I am Ollie. I have a master's degree in molecular medicine. I do go live every day covering anatomy and physiology topics and other topics that you guys do request. So the answer here to number 9 is B. Glucose remains in the filtrate and appears in urine. So when the glucose concentration exceeds the transport maximum, the renal tubules can no longer reabsorb all the glucose, and that excess glucose appears in urine. Number 10. Which segment of the nephron contributes to acid-base balance by secreting hydrogen ions and reabsorbing bicarbonate, or HCO3? Yes, I do cover some neurology, yes. My YouTube is my name. I post every single TikTok live, the replay of it to YouTube. But it's also linked in my bio. Number 10, which segment of the nephron contributes to acid-base balance by secreting hydrogen ions and reabsorbing bicarbonate, or HCO3? The answer is C, the collecting duct. C, collecting duct. The collecting duct is crucial for regulating acid-base balance. This is where it secretes hydrogen ions and reabsorbs bicarbonate. This is what is going to function to maintain our pH. Moving on to number 11. What triggers the release of renin from juxtaglomerular cells? It is, yes, it is Hungarian. I just got into the urinary system today, and the class is perfect, awesome, so glad. Thank you very much for letting me know. Took this 2 years ago, I should remember this right. Honestly, sometimes it depends how you study it. Some people remember stuff. It's a lot of information to remember after a couple years, for sure. But if you are just joining us, welcome. We are on number 11. I do post these afterwards to my YouTube. I have the YouTube up top there. It's my name. But also it's linked in my TikTok bio as well as my website with my anatomy and physiology notes. The answer to number 11, what triggers release of renin from the juxtaglomerular cells? The answer is C, is decreased blood pressure. Decreased blood pressure. So these cells in the kidney, they are going to release renin in response to decreased blood pressure. Renin will then activate the RAAS system, the renin-angiotensin-aldosterone system, and this is going to raise our blood pressure. Number 12, aldosterone increases the reabsorption of sodium in which nephron segment? To be honest though, I know that detail these questions, are they easier than step 1 or similar difficulty? Honestly, I am not too sure about step 1. This is mostly more advanced. I would say this is more like advanced undergraduate level, like kind of graduate level class. These were questions that are similar to what I, on my urinary system unit when I was in graduate school. Try to make these ones a little more challenging because people said they had some exams coming up and wanted some harder ones, so we got the harder ones today. But we are on number 12. Aldosterone increases the reabsorption of sodium in which nephron segment? Graduate school would mean like this is my master's program. I got my master's degree. So I took a medical physiology class. Let's go to LPN since this is something I should know for the future. Yep, this is great for like nursing students as well. Pretty much anyone who works in the healthcare field, this was definitely a great review for you. These questions are a lot more physiology based. I did consider doing medicine, yes. I just personally didn't really enjoy seeing patients. I'm actually going for my PhD right now. I actually like being in the lab and learning about medicine more and doing more of the academic side of medicine. Wasn't necessarily keen on seeing patients all the time. I did shadowing for a while. I didn't really enjoy it. And then I was a pharmacy tech for like 5 years. So I got pretty burnt out in the inpatient and outpatient settings. Number 12. You're studying pharmacy in Denmark. Yes, I actually always use Ninja Nerd. He's probably my favorite. Number 12, aldosterone increases the reabsorption of sodium in which nephron segment? Yeah, the kidneys are definitely brutal. I know pharmacy will definitely have more like case-based, situation-based. But for our purpose of today, of just kind of reading the questions, just kind of what we're doing today. But number 12, aldosterone increases the reabsorption of sodium in which nephron segment? The answer is C, distal tubule and collecting duct. So aldosterone will act on the DCT, on the collecting duct to increase sodium resorption. This process is crucial for maintaining sodium balance and blood pressure. 13, which hormone acts via aquaporin insertion in the collecting duct? Aquaporin. Med school so far. Well, first of all, congratulations on getting med school. Yeah, neurology is definitely very challenging. I've had some neurology classes, but definitely nowhere on the lines of medical school for sure. More so, nursing school is definitely hard. Yeah, I know a lot of people who have failed out, had trouble getting in. Definitely a hard thing to do. Which hormone acts the aquaporin insertion in the collecting duct? The answer is D. It is ADH. diuretic hormone is going to increase water reabsorption in the collecting duct by promoting the insertion of water channels or aquaporins into the membrane. Number 14, what is the effect of ADH on urine? What is the effect of ADH on urine? These questions are also great review for paramedic school, currently a medic now. Awesome, Colin. Thank you. PA school in the States is apparently crazy difficult too. Yeah, it's. I think it's more so on the difficulty level. It was ADH, antidiuretic hormone. I think PA school is challenging in the States just because you're kind of learning all the same things in medical school. Not obviously as in depth and as much. However, it's in 2 years. It's very fast paced. I think it's more so about the pacing rather than the material. They're probably pretty similar from what I've heard from people who were in both. But it's definitely a lot faster paced. Number 14, what is the effect of ADH on urine? The answer is C. It decreases urine volume and increases concentration. So ADH is going to promote water reabsorption in the collecting duct, which would reduce the urine volume and it would concentrate the urine. Number 15, what structure releases erythropoietin in response to hypoxia? So is it better to do med school or nursing school if I want to be an RN? You would not do med school to be an RN. Med school would make you an MD or a DO, so a medical doctor. RN would be to make you a nurse if you wanted to be a nurse. Number 15, what structure releases erythropoietin in response to hypoxia? The answer is D. The paratubular capillary endothelial cells. Erythropoietin is primarily released by the paratubular capillary endothelial cells in response to hypoxia. What this does is it will signal the bone marrow to produce more red blood cells. Number 16, what is the primary buffer system in the renal tubular fluid? Question that got me once was hold on, comment glitched out. The question that got me once was renin or erythropoietin hormones or proteins, or are they different? Yeah, they're both hormones, I think, but I believe they're both they're both proteins, but they're both renin's more so like an enzyme, and I guess erythropoietin's more of a hormone. That's renin would be really considered a hormone because it would be released into the bloodstream and would act on certain targets. And it would be it is a protein. And erythropoietin is a protein, like a glycoprotein hormone. It's a very confusing question. It depends how the question would be worded, I suppose. Yep, this will be on YouTube afterwards. YouTube is my name. It's also linked in my TikTok bio. But number 16, what is the primary buffer system in the renal tubular fluid? The answer is D. It is the phosphate buffer. Phosphate buffer essentially regulates pH within the renal tubular fluid by using phosphate ions to buffer the hydrogen ions. Yeah, I'm using the second generation iPad and the second generation pen. This is the 12.9 inch. I definitely recommend a bigger screen, especially if you're going to use it for college. I think the smaller one, it's a lot easier to see more information. Number 17, in response to acidosis, the kidney will. It's better word at the time. That's all right. No, it's definitely a very tricky thing to talk about. Yeah, that's a very tough question. I can see why. I would definitely trip myself up answering that. I would second guess myself a lot, I think. Weird question, but learning endocrine system 2, how can I remember TH synthesis? If you're talking about thyroid hormone synthesis, mainly if you think about, so it all starts with iodine. So iodine has to be uptaken into the thyroid's follicular cells. They have to get oxidized. That has to get incorporated into thyroglobulin. And then basically that gets kind of converted into T3. And then it gets converted into T4. I definitely recommend like writing that process out. Kind of practice explaining it out loud to yourself. Number 17, in response to acidosis, the kidney will, answer choice A, increase hydrogen secretion and reabsorb bicarbonate. So basically in acidosis, the kidney will compensate for that by secreting more hydrogen ions into the urine and reabsorbing bicarbonate to increase the blood pH. If we secrete hydrogen ions into the urine and excrete them, we will help make our pH less acidic. I wouldn't say rewriting notes is very effective. Rewriting notes isn't very effective. More so kind of doing it from memory. I always have the philosophy that if you're looking at your notes, you're not studying. You definitely have to actively recall things. Like if I were to go through and explain, if I don't have my notes in front of me, if we had to explain number 17, in response to acidosis, the kidney will, it will increase hydrogen ion secretion, and it will reabsorb bicarbonate, so HCO3 negative, and try to explain that without looking. So in acidosis, the kidney will compensate for acidosis. What is acidosis? This is essentially when the blood pH is too acidic, so we have to get rid of the hydrogen ions because that's what makes our blood acidic, and then we would reabsorb bicarbonate because that is going to buffer the hydrogen ions. So if you get rid of hydrogen ions, you are going to increase the pH. If you reabsorb bicarbonate, you are also going to increase your pH, making it less acidic. I definitely recommend studying that way and explaining it that way. Don't just rewrite your notes. That is not very effective. Number 18, hyperkalemia can result from decreased secretion of. I normally do 60, but today I think I can only do 30. I probably need to speed up a little faster, but. So the body, it responds to both respiratory acidosis and metabolic acidosis, but the mechanisms are a little different for both. Respiratory acidosis more so occurs when there's an increase of carbon dioxide in the blood, but metabolic acidosis is when there's a decrease of like bicarbonate or an increase in hydrogen ions. Number 18, hyperkalemia can result from decreased secretion of. The answer is B, aldosterone. B, aldosterone. So aldosterone stimulates potassium secretion in the collecting duct. A decrease in aldosterone would lead to reduced potassium excretion, which would cause hyperkalemia. Metabolic alkalosis can result from I just started my urinary system today. Awesome. That's good. Good to hear. So metabolic acidosis can result from excessive vomiting because you would lose a lot of stomach acid, HCl. You would lose a lot of HCl, leading to an increase. So when you HCl loss, this leads to an increase in pH, essentially leading to metabolic alkalosis. Number 20, which nephron segment plays a key role in calcium reabsorption regulated by PTH, or parathyroid hormone? Yes, Alicia. So sodium and potassium are considered inverse electrolytes because their concentrations in cells and the extracellular fluid basically oppose each other. This is basically because of the sodium-potassium ATPase pump. Probably won't be able to post it directly afterwards, but I'll definitely try to get to it. I definitely have something to get to here soon. Number 20, the answer is B. It is the distal convoluted tubule. So parathyroid hormone increases calcium reabsorption in the DCT in the nephron. 21, in diabetes insipidus, which hormone is deficient or unresponsive? Awesome. The answer is B. It is ADH. The reason being that diabetes insipidus basically is a deficiency of ADH or a resistance to its action. Basically, this would lead to there to be an inability of urine concentration, and essentially we would have excessive urination, polyuria. Number 22, proteinuria is most likely caused by damage to which structure? About all your notes for MP2 chapters. They have helped me a lot with my exams. Awesome. I'm so glad. Thank you for getting them, Maddie. I'm glad they've been helping. It makes my day. All right, number 22 is C, the glomerular filtration barrier. So when this gets compromised, essentially this allows like large proteins like albumin to leak into the urine. 23, a patient with elevated BUN and creatinine likely has. BUN stands for blood urea nitrogen. I should probably put that in there. The answer is C. It is renal failure. So elevated BUN, or blood urea nitrogen, and creatinine, they are very key indicators that there is something wrong with the kidney's function. And this is essentially what you see in acute or any sort of chronic renal failure. Awesome, guys. 24, which of the following would cause an increase in GFR? Which of the following would cause an increase in GFR? So the answer is B. It is vasodilation of afferent arterioles. So essentially, vasodilation of afferent arterioles would increase blood flow into the glomerulus, and that would increase the GFR. What career in the medical field do you recommend that doesn't deal with blood in patients? I know there's a lot of techs. You could do like X-ray tech, things like that. Or you can work in labs, like laboratory scientists. Or you could do medical clinical research. 25. What would happen to GFR if the efferent arteriole is constricted? Thanks for the follow. I really appreciate it. And thanks for liking the live, guys. Really appreciate you guys. Awesome. So number 25, what would happen to GFR if the efferent arteriole is constricted? The answer is B. GFR would increase. So constriction of the efferent arteriole would increase glomerular pressure, which would increase GFR. (26) If a drug inhibits carbonic anhydrase in the PCT, what effect would it have? What was there confusion on? Was there confusion on the question? Taking AP1 in 4 weeks, how many hours of studying per day? I actually have a video on that on my profile of how much, but I would do about 20 to 30 minutes before class, and then I would do about an hour or two after class. Then weekends, it kind of depended. 2 to 3 hours on like a Saturday, and sometimes I studied a lot on Sundays. I would study like 8 to like 14 hours on Sundays, but that included all my classes. But typically, like during the week, 1 hour to 2 hours. During the weekend, 2 to 3 hours. Number 26, if a drug inhibits carbonic anhydrase in the PCT, what effect would it have? The answer is B. Increase bicarbonate excretion. So carbonic anhydrase inhibitors decrease bicarbonate reabsorption in the PCT. Essentially what this leads to is increasing the bicarbonate excretion in the urine. It's really on per day, 3 hours should be fine to retain information. For question 25, so GFR would decrease if the afferent arteriole is constricted, not the efferent. 27, a diuretic that blocks sodium chloride symporters in the DCT would. Thank you. Yep, no problem. Or number 27, a diuretic that blocks the sodium chloride symporters in the DCT would C. It would increase potassium excretion. So diuretics that block these symporters in the DCT inhibit sodium reabsorption. What this does is this would lead to increased sodium delivery to the collecting duct. Essentially, that would cause increased potassium excretion, basically due to that sodium-potassium exchange. It's on my TikTok here. If you just go to my TikTok page here, it's down there somewhere. It's been a little while since I've made one, so I actually might make a new video on that this weekend, perhaps. These questions will be available soon. I will definitely try to make an announcement when they are available. (28) Urea recycling in the collecting duct helps. Urea recycling in the collecting duct helps. I always felt like asking how long someone would study. I feel like everyone kind of takes a different amount of time to study for things. I always thought it more so depended on, like, I think you should study as long as it takes to learn it, in my opinion. But you gotta have good balance too, so try to have a good guideline. Okay, thank you. Your practice questions are helping me in AMP2. Awesome. I'm glad they're helping, MK. Thank you for letting me know. I appreciate it. We do practice every day here, so... Number 28 is A. It is concentrate urine by maintaining the medullary gradient. So essentially, urea recycling in the collecting duct would help maintain that osmotic gradient in the renal medulla, which basically is important for when urine gets concentrated. 29, a person with a low plasma osmolality will likely produce... We're on number 29 now. A person with low plasma osmolality will likely produce... Yep, we can return to the previous sheet after this one. Yeah, absolutely. The answer here to number 29 is A. It would dilute urine due to lower ADH. So when we have low plasma osmolality, that's going to trigger a decrease in ADH release. So this would cause dilute urine production a little less. So a little less water would be reabsorbed in the collecting ducts as well. So we would have dilute urine production because less water is reabsorbed in the collecting ducts. Number 30, in chronic kidney disease, loss of nephron function leads to... In chronic kidney disease, loss of nephron function leads to... Hey, DS, how you doing? Just stopping by. Good to see you stopping in. I appreciate it. Awesome, everybody. Yes, the answer is C. It is accumulation of nitrogenous waste. So as a nephron function declines in chronic kidney disease, the kidneys are less able to filter and excrete nitrogenous waste, such as urea and creatinine. This would lead to their accumulation in the blood. We can go back to the previous slide real quick here. This will be on YouTube afterwards as well, so we're only going to stay here for just a second. And then we're going to move on to the reproductive system. Everybody. If you are just joining us, welcome in. My name is Ollie. I have a master's degree in molecular medicine, and I do go live every single day covering anatomy and physiology topics that you guys do request. I would appreciate if you guys gave the live a like. It'll get it out to more people. 1 through 9, it'll be on YouTube later. We're going to move on to number 1 in the reproductive system. What structure contributes the largest volume to semen? So grateful that I stumbled upon your live. I'm so glad that you stumbled upon my live as well. Perfect. I just subscribed. Awesome. Thank you so much. Yep. I do post every single replay of the live stream to YouTube. The only reason I don't go back all the time is, we go back a little bit here and there, but the lives would take forever if I went back for everybody. So I post them to YouTube for you to go back and watch at your convenience. We're on number 1 now. What structure contributes the largest volume to semen? What structure contributes the largest volume to semen? Give you guys a couple seconds to answer. The answer is C, is the seminal vesicles. So the seminal vesicles, they produce about 60% of the total volume of semen. That essentially will create an alkaline fluid rich in like fructose. That is going to be what is used for energy by the sperm. It also has prostaglandins and clotting proteins in there as well. The pampiniform plexus in the spermatic cord helps regulate what? T for T. That's terrible. Hello to everybody that just joined. Welcome in. We are starting the reproductive system now. I do appreciate it if you guys like the live. It will get it out to more people. Definitely want to help as many people as possible for their upcoming A&P exams. Also, if you weren't interested in the reproductive system, I will be doing the cardiovascular respiratory system on Saturday. Tomorrow will be pharmacology. Number 2 is B, testicular temperature. So that plexus is a network of veins that surround the testicular artery. Basically acts as like a heat exchanger. It cools the arterial blood entering the testes, which is crucial for our optimal sperm production. Number 3, which cells in the testes respond to luteinizing hormone and produce testosterone? Give you guys a couple seconds to answer. Thank you guys for liking the live. I really appreciate it. You guys are awesome. Thank you guys so much. The answer here is B, is Leydig cells. Leydig cells are stimulated by a luteinizing hormone. They are located between the seminiferous tubules, and they also produce testosterone. Number 4, which part of the male urethra passes through the urogenital diaphragm? Which part of the male urethra passes through the urogenital diaphragm? Sorry about that. Awesome. The answer is C. It is membranous urethra. So that's like the shortest segment, passes through the urogenital diaphragm. It's surrounded by the external urethral sphincter. Number 5, what triggers the final maturation step of sperm, called capacitation? Literally just took an exam on this. Oh no. Sorry, I wasn't here earlier for you, Sarah. I hope your exam went well. How did it go? We're on number 5 now. What triggers the final maturation step of sperm called capacitation? I got a 90. Awesome. Congrats, Sarah. Good job. Reproductive system, I think, is definitely a harder system to learn as well. So congratulations. So what triggers the final step? It is contact with the female reproductive tract. So capacitation is that biochemical process that occurs after ejaculation when a sperm enters the female reproductive tract, enabling them to fertilize the oocyte. Ejaculation, I would take ejaculation, but also it doesn't really necessarily cause capacitation though, but ejaculation does have to occur, but it's contact with the female reproductive tract that really triggers that final process. 6, what structure stores sperm while they mature and gain motility, movement? We're on number 6 now. What structure stores sperm while they mature and gain motility? The answer is D, the epididymis. It's that long, coiled duct on the posterior portion of the testes. This is where sperm basically get their ability to fertilize. They gain motility for movement. The Sertoli cells are responsible for, number 7, Sertoli cells are responsible for answer here is B, the secretion of inhibin. So Sertoli cells secrete inhibin. This is going to inhibit FSH release, and they support sperm development and form that blood testes barrier. Number 8, which enzyme is necessary for sperm to penetrate the zona pellucida? We've got a couple seconds to answer. Hello to everybody that just joined. Welcome in. My name is Ollie. I do go live every single day covering anatomy and physiology topics that you guys request. I do post these to YouTube as well afterwards. It's linked in my bio. And I also have all my notes for anatomy and physiology in my TikTok bio as well. The answer to number 8, crocin. Essentially, this is released during the acrosomal reaction. This is going to help digest the zona pellucida of the egg, which is going to enable fertilization. Number 9, which hormone inhibits FSH secretion in males? Kind of mentioned that before. Thank you for following. I really appreciate it. Thanks for joining, and thanks for liking the live and participating. You guys are awesome. But we are on number 9. I kind of talked about this in a few questions ago. Which hormone inhibits FSH secretion in males? The answer is B, it's inhibin. So inhibin is released by the Sertoli cells, which we just talked about. Selectively inhibits FSH secretion. My favorite teacher. Oh, thank you so much. You guys are all my favorite students. Number 10, a vasectomy involves cutting of which structure? Vasectomy involves cutting of which structure? That's all right. Awesome, guys. Awesome. The answer is C. It is the vas deferens. Remember that the vasectomy involves the surgical cutting and sealing of the vas deferens. This is going to prevent sperm from reaching the urethra. Number 11, which hormone promotes development of the corpus luteum? Hello to everybody that just joined. Welcome. I don't know if you mentioned, if you had a method to study, where do I find this? I do have a couple methods on my page how to study. At the end of the live stream, we can definitely talk about it. I am actually posting, so I post these live streams to YouTube afterwards. But I'm actually going to start posting content on YouTube. And I have a video coming out on Sunday. I've recorded it. I just have to edit it. It's going up on Sunday this weekend. It is going to be on how I take notes and stuff, essentially allow me to study. Well, hello to everybody that just joined. My name is Ollie. I have a master's degree in molecular medicine. I do go live every day covering anatomy and physiology and other topics that you guys do request. Right now we're doing anatomy and physiology for the reproductive system. Tomorrow we'll do some pharmacology, and then on Saturday we are going to do the cardiovascular and the respiratory systems. Number 11, which hormone promotes development of the corpus luteum? The answer is B, luteinizing hormone. Luteinizing hormone triggers ovulation, and it promotes the development of the corpus luteum from the ruptured follicle. FSH stimulates follicle growth, but is not directly involved in corpus luteum formation. Progesterone is what is secreted by the corpus luteum. It's not the hormone that would cause its formation. And then estrogen, it would increase prior to ovulation, but doesn't necessarily promote corpus luteum formation. Just going to follow you. Thank you so much. Who asked the question? Calissa, so no. Progesterone does not stop production after fertilization. It actually is going to continue to be produced, and it's actually it's the hormone that is going to maintain pregnancy and support it. So when fertilization would occur, progesterone is going to support the endometrial lining. Basically, progesterone is going to make sure it stays thick and it nourishes the developing embryo. It also will prevent uterine contractions that could lead to early miscarriages. So progesterone production would continue and actually even increase after fertilization, essentially to support pregnancy. Basically until the placenta really takes over the main role of it. Okay, gotcha. But thank you. Perfect. Glad that made sense. Number 12, the primary oocyte completes meiosis 1 just prior to. So what is the corpus luteum? The corpus luteum is a temporary endocrine structure that forms in the ovary after an egg has been released during ovulation. So it basically plays a role in regulating the menstrual cycle and supporting in earlier stages of pregnancy. So it gets more so formed after ovulation. We're at number 12 now. The primary oocyte completes meiosis 1 just prior to what? And hello to everyone that just followed. Thank you so much for following. I really appreciate you. I will be going live every day covering anatomy and physiology topics. And I will also, if you are joining late, I do post these to YouTube afterwards. It's my name, which I'll put here. And it's also linked in my TikTok bio, as well as all my study guides and notes for anatomy and physiology. And then I'm constantly posting tips and tricks of how to study the material, and I also cover material that you guys request as well. Thanks for sharing the live as well. Thanks for liking the live. Really appreciate you guys. Anyway, moving on to number 12. The primary oocyte completes meiosis 1 just prior to the answer choice B, ovulation. This would form a secondary oocyte and the first polar body. So the primary oocyte completes meiosis 1 just prior to ovulation. Number 13, the thickest layer of the uterus is the thickest layer of the uterus is the. Thank you guys for sharing the live. Thanks for liking the live. Thanks for following everybody. It's great to see some new faces around here. Appreciate you guys being here and joining me this Thursday night. We are on number 13 now for the reproductive system. The thickest layer of the uterus. Answer choice C is the myometrium. The myometrium is that muscular middle layer and the thickest part of the uterus. The Parametrium is the outermost serous layer. The endometrium is the inner mucosal layer. That's not the thickest. The basal layer is just this is just part of the endometrium. Number 14, the hormone primarily responsible for proliferation of the endometrial lining during the follicular phase is... Yay, awesome. Awesome, guys. Awesome. Hello to everybody that just joined. Welcome in. I do go live every day covering anatomy and physiology and other topics that you guys do request. It's great to see you. I always love the new faces here. My YouTube is my name. It's also linked in my TikTok bio as well. I'll write it up here, though. Uh-oh. Hold on now. TikTok thinks I'm inactive. I gotta do my little puzzle here. You guys go ahead and answer that while I do that real quick. Perfect. Just fix this. Alrighty. Number 14. The hormone primarily responsible for proliferation of the endometrial lining during the follicular phase is estrogen. This is B. So, progesterone is dominant in the luteal phase. This is the luteal. So it's the luteal phase. So estrogen stimulates the thickening of the endometrium during the follicular phase. Progesterone is dominant in the luteal phase. Progesterone luteal phase. Number 15, what structure produces progesterone during the luteal phase? The answer here is C. It is the corpus luteum. The corpus luteum is going to secrete progesterone after ovulation to maintain the endometrium, which we kind of talked about in a couple questions prior to it. And moving on to number 16. During ovulation, the oocyte is released into... What was it we're going to do live? Can I watch this later when you're not live? Yes, it's going to be on YouTube afterwards. It's going to be on YouTube afterwards. My YouTube is linked in my TikTok bio. It's also my name here, which I'll write on the screen. This may be a trick question here, but the answer is D. It is the peritoneal cavity near the fimbriae. So the oocyte is expelled into the peritoneal cavity first, and then it goes into the fallopian tube by the fimbriae. So it's near it, but it goes there first. You're literally synced with my curriculum. Perfect. I'm so glad. I'm trying to. Everyone keeps requesting for different things, so sometimes it's like throwing darts at a board or blindfolded. Number 17, what structure captures the ovulated oocyte and directs it into the fallopian tube? I kind of just answered that. The answer is fimbriae. Those are like the finger-like projections that basically move the oocyte into the fallopian tube from the peritoneal cavity. Number 18, which of the following is not a function of estrogen? Which of the following is not a function of estrogen? Give you guys a couple seconds. Hello to everybody that just joined. My name is Ollie. I do go live every single day, covering anatomy and physiology. All right, so number 18, the answer is A, maintaining pregnancy. So progesterone primarily maintains pregnancy. Estrogen supports endometrial proliferation, secondary sexual characteristics, and follicle growth, but not pregnancy. B, it does promote secondary sex characteristics. C, it does thicken the endometrium. D, stimulating follicle development. True, but that is through FSH modulation, so it is influenced by FSH. But estrogen does play a key role in developing ovarian follicles. Hopefully that made sense. Yes. Alrighty, moving on to number 19. Which hormone prevents degeneration of the corpus luteum in early pregnancy? And hello to everybody that just joined us. Welcome in. My name is Ollie. I do go live every day covering anatomy and physiology topics. Today we're doing the reproductive system. It does get posted to YouTube afterwards as well. That is linked in my TikTok bio, as well as all of my notes for anatomy and physiology. We are on number 19. Which hormone prevents degeneration of the corpus luteum in early pregnancy? The answer is D. It is HCG. Human gonadotropin from the embryo sustains the corpus luteum. Progesterone doesn't prevent the it's secreted by the corpus luteum. It doesn't sustain it. Estrogen doesn't prevent the degeneration. LH would normally support the corpus luteum, but it falls during pregnancy. So it would be HCG. Number 20, where does fertilization usually occur? Where does fertilization usually occur? Thank you for all the follows and all the likes on the live, guys. I really appreciate it. We're on number 20. Where does fertilization usually occur? Give you guys a couple seconds to answer. Again, we're on number 20. Where does fertilization usually occur? The answer is C, is ampulla of the fallopian tube. So fertilization will commonly take place in the ampulla, which is the widest portion of the fallopian tube. Number 21, which of the following occurs during the secretory phase of the uterine cycle? Which of the following occurs during the secretory phase of the uterine cycle? The answer is C. It is progesterone secretion peaks. So the secretory phase follows ovulation. So progesterone from the corpus luteum would dominate. 22. The ovarian cycle is most directly regulated by hormones from the... Hello to everybody that just joined and followed. Thank you so much for joining and following. I really appreciate you. I always love seeing new faces around here. I do go live every day covering anatomy and physiology and some other topics that you guys request as well. We are on number 22. The ovarian cycle is most directly regulated by hormones from the... The answer is A, the hypothalamus. So the hypothalamus would release GnRH. That would stimulate the anterior pituitary to secrete FSH and LH. The adrenal glands produce androgens. They're not really directly involved. Posterior pituitary releases oxytocin, ADH. They are not reproductive hormones. And the thyroid regulates metabolism, not the ovarian cycle. Number 23. If fertilization does not occur, the corpus luteum becomes the... Number 23, if fertilization does not occur, the corpus luteum becomes the So the answer is C, is the corpus albicans. So without HCH stimulating, the corpus luteum would degenerate into more so like a fibrous scar tissue. 24, which of the following hormones surges to trigger ovulation? Kind of talked about this. It's kind of like, it's referred to as the blank surge. It's about 24 to 38 hours before ovulation. Awesome. It is LH, luteinizing hormone. It is the LH surge, as it's called, LH surge. Number 25, the chromosomal reaction is triggered by, kind of talked about it a little bit earlier. Chromosomal reaction is triggered by Awesome. I'll give you guys a couple more seconds to answer. Number 25, the exosomal reaction is triggered by. Awesome. The answer is B, binding of sperm to the zona pellucida. Number 26, in polycystic ovarian syndrome, or PCOS, which hormone is often elevated? Which hormone is often elevated? Yes, these are med questions. These are anatomy and physiology. So the answer is B, insulin. So insulin resistance is common in PCOS. It can contribute to an elevated androgen levels that you see in PCOS. Estrogen may be irregular, but it's not typically elevated. FSH is normally low or normal. And cortisol is not necessarily a primary feature of PCOS. It can be, but not normally. But insulin, mainly because insulin resistance is extremely common in PCOS, and contributes to elevated androgen levels. (27) The presence of Bauer bodies in a cell indicate I'm from the UK doing med. Yeah, so these questions are more so for like advanced undergrad anatomy and physiology and some graduate level questions. So master's degree. Yes, susceptible to well, in terms of like PCOS, type 1 diabetes, I think it would be more so type 2 diabetes as opposed to type 1. They could develop type 1 diabetes, but that would be rare because type 1 diabetes is an autoimmune response, destroying your insulin-producing beta cells. Type 2 diabetes, if we're talking about insulin resistance, that'd be more so for type 2 diabetes. Okay, thanks. Yeah, definitely not necessarily type 1. Definitely possible, but not normal or likely. But type 2, absolutely. But 27, the answer is C. One inactive X chromosome in a female. One inactive chromosome. Yep, Peyton, you explained that pretty well. If you have high insulin, you don't have type 1. Type 1 diabetics don't make insulin. Yes. That's a better way to explain it than I did. Number 28, what of the following is true of oogenesis? Which of the following is true of oogenesis? I'll give you guys a couple seconds to answer. Answer choice here is going to be C. It is primary oocytes are arrested in prophase 1. Basically, that lasts until fetal life, from fetal life until ovulation. Number 29, endometrius involves. Number 29, endometrius involves. What is the best book to help with anatomy and physiology? I personally think my notes would definitely help. They're linked in my TikTok bio, but also on my website that is also linked in my TikTok bio, I have recommendations. I have a recommendation tab. They're all things that I've used and things that I've liked and continue to use today. Thanks. Yep, no problem. Yeah, definitely check out the recommendations there. I definitely have pretty much everything that I have used. Number 29 is B, the implantation of endometrial tissue outside of the uterus. So endometrial tissue grows in abnormal locations like the ovaries, pelvic cavity. Number 30, which of the following best describes menopause? Which of the following best describes menopause? This is our last question. While you guys answer that, I will be back again tomorrow. We're going to do pharmacology. In terms of what, I don't know yet. I'm not sure what type of pharmacology we will be going over. But it'll probably be around, let me see. We'll probably go around the same time, so like 6 p.m. Eastern Standard Time. Saturday, we will probably be there around 2 to 3 p.m. start time. We got to anatomy and physiology, AMP. We're going to do cardiovascular system plus respiratory system. Sunday, TBD. Probably do some, what's terrible B? Probably some Hezi and T's. The answer to number 30 is C. It is the depletion of ovarian follicles. Oops. Depletion of ovarian follicles. So menopause results when the ovaries no longer produce follicles, ending menstruation. Alrighty, that was it. Thank you guys for watching. I'll stick around here for like a minute or so, answer any just quick questions here. We'll be back again tomorrow. Sunday is to be determined. It'll probably be later on. I think probably around like 5 or 5:30 p.m. Definitely later, though. My YouTube was my name. Thank you, D-Nice, for stopping by. Good to see you again. It's linked in my TikTok bio. And then my anatomy and physiology notes are linked in my bio as well. It's on my website, Medzig. I do have reproductive system notes and urinary system notes. These questions, no, are not like the T's. But the ones on Sunday will be, yes. Thank you so much. Appreciate your lessons. I appreciate you for joining. Tomorrow we'll do pharmacology. I think I've only really seen cardiovascular system pharmacology requested. Alex, thank you. Thank you, Kiana. Thank you. But if anyone else has any other requests for tomorrow's live, I'd be more than happy to take them. But it'll be tomorrow night, Friday night. Lovely Friday night going live on TikTok covering pharmacology, of course. But yeah, it'll probably be around 6 p.m. Eastern Standard Time, potentially 7. It's helping me prepare for my chiropractic boards. Awesome, I'm so glad. I've actually thought about becoming a chiropractor. How are you enjoying chiropractor program? Cardiology? Okay. We'll definitely do some cardiology then tomorrow. Yeah, that's my website. This is my YouTube. I'll post that afterwards. Any other quick questions here before I get going? I do appreciate you all being here. This has been so much fun. You guys are awesome. I love doing this with you guys. It's just so much fun. Yeah, we can do some embryology. Is there any specific topic in embryology that you would like? Yep, we can definitely cover that here soon. Alrighty, any other quick questions here before I get going? I am going to get going. But it was great being on the live with you guys tonight. You guys are awesome. Love you guys. You guys make this so much fun. Thank you guys so much. You guys have a great rest of your night.